So specifically, what is Ehlers-Danlos syndrome or EDS? The wordy definition is that it is a clinically and genetically heterogeneous group of heritable connective tissue disorders. So what we're seeing are multiple different classifications genetically of Ehlers-Danlos syndrome amongst different parts of the gene area that we're finding this on. So again, it could affect collagen, it could affect proteoglycans, and it could affect collagen synthesis. So we're seeing this a little bit different of a spectrum for the type of Ehlers-Danlos syndrome that's classified. Generally, when we look at EDS, this is characterized by joint hypermobility, skin hypermobility, and tissue fragility. As we start to get a little bit more into the specifics of EDS and the different classifications, you'll see it very much depends on the individual and also the type of gene that's involved. So we have Ehlers-Danlos syndrome. We have many classifications of that, but what is this hypermobility spectrum disorder that is now being used as a term? So hypermobility spectrum disorders, or HSD, are a group of conditions that are related to joint hypermobility. So this is specifically related to symptomatic joint hypermobility and does not include asymptomatic presentations. So these are the patients that are symptomatically presenting in potentially multiple systems or multiple areas of their body with chronic ailments. Hypermobility spectrum disorders, they're intended to be diagnosed after those other possible answers are excluded. So looking through all the categories of EDS, and these patients just don't fit, especially HEDS, which is very much more specific in how it's diagnosed. So then we would potentially look at a diagnosis of hypermobility spectrum disorder if these patients are seeming to be in the symptomatic joint hypermobility group. Hypermobility spectrum disorder currently has no genetic marker to be able to investigate.